Many thanks for choosing us. COVID-19 cases in Ghana on the uptake. There have been two major updates. First, 437 new cases and then 509 new cases. Latest figures from the Ghana Health Service show there are currently 2,428 active cases. And here you are on the dashboard. 509 cases new, active cases 2,428. Confirmed cases 133,555. Recoveries now 129,862. And deaths have they are over 1,000 now, 1,265. And then you can see those red circles in the map. Ashanti region and the Greater Accra region topping the list. We're told the Ashanti region is recording its fourth wave already, and the Ghana Health Service is warning the country could be recording a fourth wave if we do not check. The Ghana Medical Association is calling for urgent scale-up of COVID-19 testing and contact tracing for all positive cases, as well as strict isolation and management of infected persons to help break the chain of transmission. In the last few hours, it's been sharing a statement with us. I'll read excerpts of the statement. It says it will go ahead to enforce its latest restrictions on large... Okay, so that's the Ghana Health Service giving you that. But the statement by the Ghana Medical Association says that in the last couple of weeks, our COVID-19 testing sites and health facilities have witnessed a sharp increase in number of positive cases over the last 1 week, especially in Greater Accra and Ashanti regions, with alarming daily positivity rates ranging between 40% to 50%. This escalation in cases is likely driven by the Omicron variant of the SARS-CoV-2 virus, which is highly proven to be more transmissible than hitherto dreaded Delta variant, which dominated our third wave of COVID-19. This is a very worrying development which calls for concern by all well-meaning Ghanaians, especially as we enter the Christmas and New Year festivities with their characteristic mass events and celebrations that tend to bring huge numbers of people together. Ghanaians are therefore entreated to visit health facilities to get tested if they have headaches, extreme fatigue, fever, and other flu-like symptoms, and as much as possible, desist from self-medication, especially for improving malaria. It is utmost important that as we enter into Christmas, New Year period, we take these facts into consideration to avert a fourth wave. One, the COVID-19 pandemic still poses an existential challenge to health of all persons living in the country. Two, the escalation of cases of the disease, if not checked, has the potential of further weakening already fragile health system. Three, the non-adherence to preventive measures, especially during this festive season, has the potential to further escalate the spread of the disease and its attendant consequences for individuals, families, and the country as a whole. All Ghanaians should take advantage of the Ghana Health Service, for that matter, government's drive to vaccinate all Ghanaians of age 15 years and above. The Ghana Medical Association also calls on central government, Ghana Police Service, Metropolitan Municipal District Assemblies, as well as the Ghana Tourism Authority to strictly enforce all COVID-19 protocols at all events and celebrations and bring all offenders to book without fear or favor to prevent a potential deadly fourth wave of COVID-19 in the country. As a matter of urgency, social activities such as parties, nightclubs, church services, market activities, funerals, and other mass gatherings of such nature should be regulated or restricted. Failure to do this may have dire consequences for all of us come the year 2022. Government should also ensure prompt, continuous, and adequate supply and distribution of PPE to all health workers in the various health institutions. The GMA calls for an urgent scale-up of COVID-19 testing and contact tracing for all positive cases, as well as strict isolation and management of all infected persons to help break the chain of transmission. The Ministry of Health, Ghana Health Service, and National Commission for Civic Education should relaunch the intensified COVID-19 education. The GMA urges all media houses continue their good work on COVID-19 public education. And the GMA entreats all Ghanaians to take their personal safety into their hands by adhering strictly to all the COVID-19 safety protocols. We celebrate the birth of Christ and the New Year. We wish Ghanaians best of tidings for Christmas season and prosperous New Year. And it's signed by Dr. Frank Sribo, who is president, and Dr. Titus Bayu, who is general secretary. Meanwhile, the Ghana Health Service says it will go ahead to enforce its latest restrictions on large indoor events this Christmas, despite a pushback by some event organizers who say it is too late to cancel their shows. The Health Service served notice that it will not allow large indoor events following the latest spikes in the country's COVID cases. Ghana's active COVID-19 cases currently has gone up, and this is the highest jump in new infections since the end of the third wave. Well, this afternoon, the Ghana Health Service says it is working with Ghana Tourism Authority to enforce its latest restrictions on large indoor events.
We are encouraging only open door events as short as possible. And so we have a team that is working with the tourism board, but as much as possible, everybody must avoid an indoor event.
But Dr. Kumabwaji, there are a lot of indoor events being advertised. What is going to happen? I mean, you've talked about you teaming up with the Ghana Tourism Authority. What are you going to do now? Yesterday, there was an indoor event. There will be indoor events, on the 24th, 25th, 26th. What are you going to do about these indoor events?
Well, we'll recommend that you do it in an open space for the sake of all Ghanaians.
If a country,
we are working with tourism board, who have the authority to engage such people and also give them. And we are working very closely together.
So if it can't be done in the open space around that time, will the event still come off?
I say we will continue to engage.
Yes, but I want to understand something. So as you engage...
Well, it should be in the interest of all of us that such an event doesn't take place. But I say that we are not going to say, by all means, don't do it. We have the process of engagement and providing alternatives for such events to take place.
Alternatives. And the alternatives will be change of venue.
An open space.
An open space.
Where it's safer. Where we feel all feel safer.
Okay.
Get on Zoom and speak with Dr. Peter Kwashi, who is a senior research fellow and virologist at the West African Center for Cell Biology of Infectious Pathogens, WACBIC. I'm grateful for your time, Dr. Kwashi.
Good evening.
Right. What could be accounting for the dramatic shoot in infections in the last 24 hours?
Well, I mean, we are recording a dramatic rise within the last 24 hours, but that doesn't mean that it's what we're detecting. What it means is that we actually have a very high current load in the country. It's just that now we are starting to see it. And we've seen, it's very likely that this could be Omicron, because we saw how it rose up very quickly in South Africa. It rose up very quickly in Europe. And within a matter of weeks, it was dominating all samples. Of course, currently, with the sequencing data we have to date, Omicron is not the majority. It's still the Delta variant. But what this is telling us that likely in our ongoing run, which is the data is going to come out soon, I suspect that we'll find that Omicron has already started to become dominant. And looking at the statement from the Ghana Medical Association, this is actually reflective of what I know personally. Some of the tests that we do as part of our screening exercises, in terms of antigen tests, for instance, normally you wouldn't see more than 20% positivity rate. We're seeing something around 50% positivity rate. And I just got off the phone with a colleague who owns a testing facility, and they're seeing almost up to 80% positivity rate in some instances. So this tells us that it's not that we are about to go into a wave. We are probably at the beginning of a wave, if not already in it. And because this particular variant really spreads very quickly.
How dangerous is this situation?
So currently, the data on whether it's there's no data showing that it's more pathogenic than, let's say, Delta, right? But as with all of these variants, once it's more transmissible, then the number of people who get sick will become much more. And then there's a danger of overwhelming the health systems. I know that in the different formerly COVID-19 hospitals, they're starting to set up the treatment facilities again in preparation. So I will say that for probably the first, this is one of the first ways where we are trying to be very prepared for it.
Well, let's look at the Omicron variant and the Delta variant, because you've spoken about right now having more Delta variant, but new figures could show that Omicron is dominating. What's the difference between these two?
So they share a lot of similar mutations, but the main thing with the Omicron variant is that it has within the spike protein, which is the protein that the virus uses to attach to the human cells, it has up to 32 different changes. So from the original spike, Delta, I forget the exact number, but I don't think Delta had more than 20 changes within that protein from the original. But so this means that your immune system, and all these changes are around the place where your immune system would recognize this virus. So it means that this virus somehow is evading your immune system. And yet, so far, it doesn't seem to be causing more severe disease. And I think that's also in part due to the vaccinations, because a lot of the new cases now are people who have been traveling, and those people have been vaccinated. Now in Ghana, we only have a vaccination rate of about 5%. If people who are not vaccinated start to get Omicron, there's no telling what we will see, right? In the countries where Omicron has spread and where we have data, they have high vaccination rates. So this is another indication that we should really ramp up, and people should line up and run to get vaccinated, because we don't know what's going to happen when the masses who are not vaccinated end up getting Omicron.
Now we're told that we need to cut down on events. It looks like it's going to be difficult. I mean, if you look at the whole list of things that the GMA is advising that the public do, it's for us not to go to large gatherings, and also ensure we are around areas that have ventilation. This will be difficult. What do you advise with what you know from where you sit?
So, I mean, I think the advice of the GMA is in order, and it's in line with everything that we've been advising since the start of the pandemic. And I agree that given what we saw last year, and given the way that people have really planned to celebrate this Christmas, I think it's going to be very difficult. Listening to the Director General of the Ghana Health Service, I think it's good that they're willing to engage, because yes, outdoor spaces is the best place to hold events since COVID came. And since it looks like some of these venues might have, or some of these events might be difficult to change the venues, then you would have to look at things like reducing the capacity. So if the event was for 10,000 people, typically what is done elsewhere is 50% capacity, maybe 20% capacity, things like that.
I'm grateful for your time. Dr. Peter Kwashi, a senior research fellow and virologist at WACBIP. The Northeast region has missed its COVID-19 vaccination target of 381,701 persons for the year. The region currently, as of 20th December 2021, had vaccinated only 115,221 people after taking delivery of a total of 160,226 doses of all types of COVID-19 vaccines. The percentage of all persons who have so far taken at least one dose is 30.2%, and 16.9% are persons who have fully completed the COVID vaccination. The Regional Health Director, Dr. Abdullah Abubakar, speaking at a media engagement in the capital, Nalerugu, attributed the situation to hesitancy towards the vaccines and inadequate COVID-19 education in some parts of the region.
Dr. Abdullah also provided details on the time and number of doses received since from March this year when the vaccination started in the region.
As we all know, the month of December had been declared as a month of COVID-19 vaccination. And so we took delivery of 8,500 doses of AstraZeneca, 43,200 doses of Johnson & Johnson, 13,902 doses of Pfizer, and 6,160 doses of Moderna. All this for the month of December.
The regional director disclosed that the region couldn't achieve its vaccination target for the year despite receiving over 160,000 doses of all types of COVID-19 vaccines.
Mr. Chairman, the Northeast region has a COVID vaccination target of 381,701. And currently, as at yesterday, 20th December 2021, the region has taken delivery of 160,226 doses of all types of COVID-19 vaccines and vaccinated 115,221 persons. The percentage of all persons who have so far taken at least one dose of COVID vaccine stands at 30.2%, and 16.9% are persons who have fully completed the COVID-19 vaccination. I would therefore like to state that we still have some stock of COVID-19 vaccine on our hands. Currently, we have about 16,133 doses.
Dr. Abdullah ended his address by calling on all, especially members of the Public Health Emergency Management Committee, the media, chiefs, queen mothers, pastors to support in getting the rest of the population in the region vaccinated.
Before I take my seat, kindly permit me to re-emphasize that the current biggest health threat, as we all know, to our survival on this planet is this COVID-19 pandemic. But fortunately, we now have the vaccine for it. So I would like to make a passionate appeal to all our community members who have not yet taken the vaccine to get vaccinated.